welcome to Adultlandia, or how to prepare for the adult healthcare system. This morning, I'm going to discuss the who, when, and how of medical transition. 18 years old is an adult for insurance or billing purposes. So if you or your young person are already established with a family medicine practitioner or a med-peds physician, good news, you can continue to receive medical care at the same familiar office. If, however, you have enjoyed a relationship with a pediatrician for the last 18 to 21 years, it's time to find an adult provider. What kind of primary care clinician should you look for? If you are relatively healthy and have what are considered general medical conditions such as asthma, celiac disease, or constipation, you can probably see what's called a general internist at an internal medicine clinic, and maybe even the clinician that your parent sees. And depending on the severity of your condition, that person may be able to manage them for you without a specialist. For instance, hypothyroidism may not require an adult endocrinologist. However, someone with type 1 diabetes should still see endocrinology, and somebody with trisomy 21 should establish with the Adult Down Syndrome Center. Individuals with developmental disabilities may want to look for a savvy family medicine practitioner like Dr. Mary Nagwit, or someone who is trained in internal medicine and pediatrics, what we call med-peds for short, since doctors like Dr. Corey Tuchik have experience with both pediatric and adult conditions. Now, if you need more help with adolescent problems or finding an adult provider than your pediatrician is able to offer, I highly recommend the adolescent and young adult medicine clinics. They can work on adulting skills such as navigating the healthcare system or do things like menstrual regulation, and all up to the age of 26. So you could consider them like a rest stop on your way to Adultlandia, either temporarily as your PCP or as a consultant to your pediatrician. And clinicians, I'd like to let you know that you can also e-consult your colleagues, Drs. Jacqueline Rankin or Loretta Mateo, if you need help in this area. Another answer to the question of who might be the clinic that I direct, Dr. Alda Maria Gonzaga founded the Progressive Evaluation and Referral Center, or PERC clinic, in 2006 as a counterpart to the Adolescent Bridges Clinic. But rather than handing off patients to other adult providers, she ended up keeping most of them. Dr. Reed Van Duzen joined her in 2008, and I came on 3 years ago. We are all med-peds trained and offer primary care to individuals with 2 or 3 of these admission criteria: childhood onset medical complexity, intellectual or developmental disability, and technology dependence. And by that, I don't mean that their cell phone is never out of their hand. I mean things like trachs, feeding tubes, mobility, and communication devices. No one is too complicated for us. Now, one of the perks of PERC is that we can schedule longer visits to make sure we have enough time to answer all of your questions. And if you happen to have found a PCP closer to where you live, but just wish that there was someone in Pittsburgh to help oversee some of the details, the good news is that PERC also provides care coordination, just like the complex care clinic does at Children's. You could see us once or twice a year via video to facilitate communication among specialists, troubleshoot durable medical equipment, while keeping a closer PCP for acute visits and flu shots. If for whatever reason PERC is not a good fit, we will find you another PCP. PERC is different from other primary care clinics. Because we take care of complicated patients, you can't just call to make an appointment. We do have an admissions process facilitated by our administrator to have a safe transfer of care. So in addition to meeting these 3 criteria, we do require doc-to-doc sign out, either a written transfer summary or else a short phone call. This should give an overview of the individual's medical journey. Maybe they had a lot of surgeries when they were an infant, but now they're doing great, and provide some best practices for working with them. So for instance, do we need to reserve a larger room to make sure there's space for a stretcher, or do we need to invite a translator? Can they sit quietly in the waiting room, or do they need to be roomed immediately? Are there triggering topics that we should avoid discussing in front of the young person? Should we plan to have a quick physical exam when we first meet them, and then let a caregiver take them out while we talk to the parent about the histories? Or are they capable of making any of their own decisions? And if not, who does make those decisions? These are the kinds of details that rarely make it into the typical office visit note, but if they are communicated with the adult provider, they set everybody up for success. Now, PERC requires a transfer summary, but it's actually a good idea for any transition of the young person if they have healthcare complexity. And here's a pro tip. You don't have to wait for the pediatrician to find time in their busy schedule to write one. A caregiver or even the patient themselves can write a first draft for their PCP to review. And don't feel like you have to get this all done at the 18-year well child check. It's possible to schedule a visit just to talk about transition, and there are billing codes for that. If you are interested in coming to PERC, once we get the transfer summary, I review it to make sure that the clinic is a good fit, and then I'll decide how long that first visit will be. I see patients in Oakland as well as in West Mifflin with a 1 to 3 month wait. Dr. Van Dusen sees patients in Oakland and at Turtle Creek, usually with a 6 month wait, and Dr. Gonzaga is no longer taking new patients. So this gets us back to the question of when. Every pediatric practice is different, so you'll have to ask both your PCP and your specialists when they expect you to start seeing an adult provider and whether they have a recommendation of whom you should see. Just as it is possible to come to Lawrenceville to see most or all of your doctors, many of the adult specialists in Oakland for UPMC are in Oakland and on the north side for AHN. Unfortunately, UPMC does not yet have patient navigators on the adult side, so it is a little more difficult to schedule multiple visits on the same day. Furthermore, the national guidelines at gottransition.org recommend changing providers when you're relatively healthy or stable. It's even harder, potentially unsafe, to go to a new PCP in the middle of a workup or after a prolonged hospital stay, because then that new provider has to learn all about you and also figure out what is going wrong. Please know that we're not able to write referrals or orders until we've seen you, but most pediatricians will continue to provide refills until you've established with a new PCP. And therefore, the best time to start looking for an adult provider is usually about the age of 18 to 21, just when you don't think that you need a doctor. And don't worry about changing all of your providers all at once. It might make sense to have a getting to know you visit with the new adult provider, even if you're not due for an annual exam, and then they can help you find your specialists one by one. At that first visit, your new PCP will probably review your diagnoses, any surgeries that you've had, and the medications that you take. It's helpful to bring a list of your team members, such as specialists, therapists, DME companies, and your supports coordinator. If you have guardianship or power of attorney paperwork, that's great. And if you need guardianship, we can fill out that paperwork or even testify once we've gotten to know you. Medical clinics will pretty much always talk to caregivers, but insurance and DME companies might require proof that the young person is unable to represent themselves. We can also get you a patient representative form so that you can set up a patient portal account on their behalf. So the adult version of My CHP is My UPMC on the UPMC side and My Chart on the AHN side. And at this time, adult providers can sometimes see some pediatric notes, but not all of them typically. And this brings me to my last topic, which is one that causes a lot of angst, and that's inpatient care. Children's Hospital of Pittsburgh will admit you or your young person until the age of 26, But no later than then, they do expect you to move into the adult system. This is to let younger patients use those beds, and because the older you get, the more likely you are to have adult problems. And while the buildings may not be as pretty to look at as this one, the people in them are just as caring, and the tools and equipment are the right size for adult bodies. You can, of course, go to the closest hospital, and I have, for instance, heard wonderful things about St. Clair Hospital. At UPMC, burn care is centered at Mercy, and Shadyside Hospital is the place to go for cancer care. If you have many UPMC specialists, you might want to go to the Presbyterian emergency room. Surgical patients are usually admitted to Presby, while medical patients are usually admitted across the bridge at Montefiore. Just like at Children's, your care will typically be in the hands of a hospitalist, a doctor who specializes in patients who are in the hospital, or maybe a teaching team consisting of a supervising attending physician, overseeing residents who are already practicing doctors with MD or DO degrees, and medical students who are nearing graduation. With a few exceptions, your PCP or specialist will not be the person in charge of your care in the hospital, but they might stop by for a visit and/or talk to the team. And then after any hospitalization or serious emergency room visit, please call your PCP or specialist to make an appointment to review changes to your care. Hospitalization for any reason is already stressful, and changing from children's to an adult hospital may be the last great leap in medical transition. And here are a couple of things that I'd like you to know. The first is that if you take care of a young person with increased communication needs, they have the right under the Americans with Disabilities Act to have a caregiver remain with them 24 hours a day, 7 days a week. I know that at the beginning of the COVID-19 pandemic, the rules were really strict about accompanying adults, but those have relaxed. Masking is also optional, although you do have the right to request that caregivers are masked when they are in your room if you're worried about infection. Many shared rooms are being renovated into single rooms to create more room and privacy so that a caregiver could spend the night. And if you can't be physically present, go ahead and leave your phone number on the whiteboard in the room so the team can call you during morning rounds or if there are updates later in the day. At UPMC, the Disability Resource Center runs a service called Let UPMC Help You, or LUHU. You can contact them before a clinic visit or during an admission if you have any questions about accessible parking, bathrooms, an iPad with communication apps, or what to do with a service animal. And that's it. Transitioning from the comfort of pediatrics to the strange land of adult medicine can be anxiety-provoking. Please know that there are a lot of people who want to help you succeed and are here to point you in the right direction. I like to tell my patients, I know you just spent 20 or 25 years with your previous provider, and I hope to care for you for at least as long.